Hi, this is Dr. David Wade, and I wanted to talk to you a little bit about whiplash injuries and how these injuries can cause chronic pain. The bottom line is that whiplash injuries used to be considered no big deal, but times have changed. Doctors now know that whiplash can cause lifelong pain and disability if not properly treated. During a car accident, the head often moves forward and backwards with a tremendous amount of force, and even low-speed collisions can generate enough force to injure the delicate ligaments of your neck that support your head. So why does this matter? Well, when you experience a whiplash injury and your head and neck extend beyond their normal range of motion, it can create partial tears or other damage to the muscles and ligaments around your spine and injure the spinal disc, the nerves, the muscles, and the connective tissue that holds everything together. There's a few key indicators that you may have suffered a whiplash injury, which includes neck pain, stiffness, headaches, dizziness, pain that radiates out into your arms or shoulders, or restricted motion or limited motion in your neck or back. Now, it's estimated that about 80% of people involved in car accidents will sustain a whiplash injury. Whiplash injuries are now considered severe and often permanent injuries due to the ligaments of the neck that occur after the rapid back and forth motion that's experienced during an accident. There's really two different types of connective tissue. There's collagen and elastin. Collagen is kind of stiff and strong. Elastin is strong, but it's pliable. If you've had an injury that's stretched or over-torn the connective tissue, the elastin and the collagen, it's rare for the elastin to come back to normal. So you end up with some degree of imbalance, and it's always stiffer, weaker, and more sensitive in the future. So what you have to really understand is that nearly 50% of the people with neck pain or whiplash following a car accident will actually continue to have pain over 1 year after their initial injury, simply because of the ligament laxity. There is something now that they call altered motion segment integrity, and we have a way to measure that utilizing computerized technology that can define the actual level of impairment that may be existing. I have obtained this type of information because of the certification that I have in spinal trauma and primary spine care. So your next step after a car accident is to make sure that you receive a proper diagnosis and the appropriate care that can help reduce the likelihood of you struggling with a lifetime of chronic neck pain. Our practice is focused on accurately assessing, documenting, and treating people who've been involved in a car accident. We'd really like to help you regain your quality of life as quickly as possible. So there's a lot of good information, but one of the most recent research journals is called the European Spine Journal, and there was an article that was entitled "The Association Between a Lifetime History of Neck Injury in a Motor Vehicle Collision and Future Neck Pain." So don't let yourself fall victim to having chronic neck pain because of an inappropriately evaluated and managed neck problem. Now, be aware that going to the emergency room is usually the first step after a car accident, but they're not trained or interested in really assessing the ligamentous damage. They want to find out, number one, did you tear or are you cut or bleeding? Did you fracture something? Beyond that, if there's nothing fractured and they've stopped the bleeding, then you're kind of on your own. And that's where you probably should come to see us in our office, because we are certified in primary spine care and spine trauma. This is Dr. David Wade at Anniston Chiropractic, operating under NUVO Health and Wellness. Looking forward to meeting you, and thanks.